An injured knee might look pretty simple, but there's a whole person behind that injury. One who misses the feel of his jump shot and spending time with friends on the court. It's not enough just to heal. He needs to get back out there. At Trinity Health, we're here to help you reach your goals. We combine all the knowledge and expertise of a national health system with personalized health care that treats the individual behind the injury. Because we see all of you.
All right, folks, I want to thank you so very much for tuning in to the TV show Black Perspective. The 1st of April marked an incredibly important day, particularly for not just people of color, but for the country and for those individuals who are aspiring to create an even balanced or a equal standing as it relates to health in our nation. April 1st marked the National Minority Health Month. And I've got an incredible guest. Straight out the box, Trinity Health is our new sponsor, and they came out with the big guns of glaring. And they gave me a gentleman by the name of Dr. Brandon Francis, who is the Chief Medical Officer at Trinity Health Grand Rapids. But before I go to him, I want to share something real quick about a story in his life that I want to just piggyback on in my interview. Dr. Francis, when he was a child, his mom got very sick and was taken to the hospital. The doctors he met were not very nice and completely disinterested. Finally, a new doctor came in and he said, "Oh, we need to treat her right away." His mom had an ectopic, and that's ECTOPIC, folks, pregnancy. That can be a life-threatening condition. And as you all know, we've had a couple of prominent sprinters who have lost their life, women of color, during childbirth or during pregnancy. But anyway, that's a life-threatening condition. You take care of it right away. She came back from surgery and started waking up after the anesthesia. Dr. Francis remembers, folks, sitting next to her bed, his mother's bed, and was old enough to know that something wasn't right. This is a kid. He knew back then if you were a Black woman with belly pain, it wasn't that important. But it was important enough to change this man's life. So Dr. Francis remembers telling his mom about this and being so upset, folks. And his mom's response, and this is a traditional Black woman. She said to him, Brandon A. Francis, you have a choice. You can either complain about it or do something about it. She knew her son. She knew him. At that moment, Dr. Francis decided he would be a physician and never let someone else feel the same way his mom had felt. I want to thank Dr. Francis, folks, from Trinity Health Systems so very much for being a part of our discussion. How you doing, Dr. Francis?
Well, Tyrone, thanks for having me. That story still gives me chills just thinking about it. I remember that day very well.
I would have asked you to say it, but I really wanted people to just take a moment. And I'd like to, if you would, talk to us a little bit about that story with regard to what you felt and what the environment was like and what did you witness and how did you feel that? Share that with us real quick, if you would.
Oh, sure. I'm happy to. I think at the time I was young, and you get this sense that something just doesn't feel right. Something is wrong. And you don't have the knowledge base, at least I didn't as a young kid, to know what the problem was. I just knew my mom was sick. And I also got the sense of there was a lack of urgency or interest in those around, at least not in the way that I felt. And I recognize even today as a physician that what I consider to be an emergency is not necessarily what patients and their families see as an emergency, but there's a way to communicate that. There's a way to talk about that so that they understand that, okay, this is important, but you're not at the point where we have to emergently take you. And when that new doctor came in and said, it was clear to me that it was a problem earlier as well from the way he was acting. And I felt so relieved that he took her And she came back and woke up started waking up right away. She was in a coma before they took her. So to me, it felt like something was clearly wrong. And I just remember being so upset that something like that could happen to a human being, let alone my mom. And, having her tell me that either you can complain or do something, I said, fine, never again, not on my watch, not during my time. And it's hard to stick with an idea like that to the point where you're going to actually go through the material. And now on this side of it, connecting with all people, because it's not just people of color that struggle in the system, right? It's many people's struggle in the system because the system isn't optimized for everyone yet. We have a long way to go.
You know what, Dr. Francis, you didn't just stop by becoming a doctor. I mean, you really are in a position to influence how staff interacts with their patients. You are the chief medical officer responsible for quality control as it relates to how medical services are provided to your constituents, to your patient base. Let's talk a little bit more about what your role is at Trinity Health Grand Rapids, as well as how your role is going to influence Trinity's presence, their thumbprint, during National Minority Health in the communities that you serve.
So as Chief Medical Officer, you're absolutely right. I'm responsible for the safety and quality of all things that touch patients. It is more than that, though. In my mind, it's about all those people who entrust us with their care. And the word is entrust, because we do have to have that relationship with the community that they will entrust us with their care. Because they have choices, right? They can go other places. When it comes to how we engage with the people, because they're not just people, they're people, they're human beings that entrust us with their care, it's really about meeting them with the platinum rule. People are familiar with the golden rule, how treat others as you want to be treated. Nothing's wrong with that idea, but I think we've recognized we have to elevate ourselves to treat people how they want to be treated. That's really the goal, right? Because each person is different, and recognizing that is really important. And I think in terms of our thumbprint on health equity, I struggle with this sometimes because I recognize the intent behind having a month for certain events, Black History Month or Women's, you name it. And it's important to have that recognition. Do not get me wrong. But I think it's more than a month. I think it should be an ethos, a way of life, a way of thinking about things all the time. And I think the first step we have to take when it comes to health equity is to stop arguing as to whether or not the data is there's evidence and whether or not it's meaningful and all. Let's get past that, and let's recognize that we should stop arguing and wanting equal care, because you're going to hear people in the healthcare industry, they will all say this to you. They will all say, we treat everyone equally. Yeah, that's part of the problem. We need to escalate and elevate ourselves to achieve equal outcomes, because what we want to have the same excellent outcomes for everyone. Now, that might mean person A might need nothing to get to that outcome. Person B might need a pill. Person C might need surgery. Person D might need childcare. Right? So there's all these different things which we can think about that can contribute to the health of a population. And health equity is the recognition that we want to have equal outcomes as our target. And that's what Trinity Health Grand Rapids is really working on.
Excellent. Also, Trinity Health has increasingly created partnerships in the health community. Currently, with regard to the National Minority Health Month, the FDA, Office of the Minority Health and Health Equity, has designated this month to focus on advancing health equity and reducing health disparities among racial and ethnic minority and other diverse populations. Tell me how Trinity is trying to meet this mission in its transformational healing presence in our communities?
Well, let's start with the last part of what you just said. You just highlighted the mission of Trinity Health, to be a transforming healing presence in the community. Notice the word healthcare is not at the center of that sentence. It's a transforming healing presence. So that means we have to recognize what the problems are in our community. Well, in our community, we recognize there's a housing opportunity. And so Trinity Health Grand Rapids has partnered with THGR Ministries to help provide housing for some of the women at risk in our community. It's really important because you know what? It's really hard to get a job or to take care of yourself when you don't have a place to go back to, a safe home to go back to, right? And so and I want to be very careful here because I recognize that this is not the answer. We're not gonna solve it ourselves. And I don't want to hold this up as being we are greater than everyone else because we're doing some of these things. But I want to demonstrate that we're trying to take a step forward, that's the first step, is to make an attempt at addressing some of these things, right? We've partnered with groups on providing food and resources for families. We have a partnership with organizations around maternal and fetal health for minorities. And you know what's amazing? When you give people food, you know what they do? They eat it.
That's right.
They eat it, and they get healthier. Like it seems mind blowing, right? And yet we argued about this for time on time.
Yeah.
So yes, we are partnering with groups. We're seeing improved outcomes in these maternal populations. We're seeing lower infant mortality in the groups that we're engaging with. And you know, the engagement we're doing, let me put it in perspective for you. We're bringing people to them to find out what resources they need. Do they need transportation? Do they need a social worker? What is it they need? And we're making those bridging connections for them, and they're having better outcomes. But Trinity's doing a lot of good work in this space.
Absolutely. Let me cut right here though. One of the things that Trinity has done is they've done this what I would describe as micro healthcare distribution, not instead of macro. Macro being the hospital itself, but you have sites with health facilities like Browning Clater. You've got an organization out over on the east side of the state for our viewers over there, where you have gardens. You're feeding people, like you just said. Great point. But you guys have outreached with dealing with diabetes, dealing with a number of health issues. Talk to me a little bit about, and by the way, you guys provide free or low cost, services to individuals in those types of situations as it relates to services. And you guys also provide, as I saw, food for individuals who can't afford food through the garden program. Is that correct over on the east side?
You're cutting up a little bit for me in our connection.
Let's sum it up on, you guys do a lot of philanthropic things where you engage the community, you provide services, you provide resources, practically free in most instances, but very low cost in other instances. Share with us a little bit about that, and then, share with us a little bit about that.
A great question, and you're absolutely right. Trinity does provide free or low cost support for patients and community members around some of these health issues. One of the things we're particularly proud of is one of our pharmacy programs, where we are providing medicines to at home for the patients. We're making sure they get them where they are. Again, it's a low cost option for people. It's lower cost than the retail pharmacies. Which, patients with diabetes, it's a chronic condition. It's a long-term, oftentimes lifelong for many people, unfortunately, and it can be quite expensive. So having a lower cost option for them in their home, so it's convenient for them to get their meds, is a big deal. And when I say a big deal, it's improved their hemoglobin A1C, which for those at home who have diabetes or know about diabetes, lowering that number means your diabetes treatment is working, it's getting better, and you're at lower risk for complicated problems like cardiovascular problems, which we know is a silent killer for many of minority groups that have diabetes. So it's a big deal.
Well, I want to say this to you, Dr. Francis. One, you actually, and I thought I was too old to get this way anymore, but you've inspired me. God's honest truth, you've inspired me, man. And this is to see a young child watch his mother go through something and become motivated to not only make sure that his mother not have that experience again, but to make sure other mothers won't have that experience, or other people like yourself not have to witness that experience. That was extremely powerful to me. And I want to just take my hat off because I do think it's a part of what you are as far as a leader with all the things that you guys are doing philanthropically, because I just want to mention, if I could, that you got Clinica Santa Maria in Grand Rapids, where it's bilingual and they provide services to the Hispanic community. Browning Clater Health Clinic on the southeast side of Grand Rapids, Michigan. Strong Beginnings, which is a African-American health type institute. Prescription for Health, guys providing those type of services. Farm at Trinity Health, Michigan, Ann Arbor, Pontiac, and soon to be in Muskegon. That's the food program we talked about. Safety Net Health Center program in Detroit Ministries. The fact that you guys have reached out to 32 Michigan counties where you're dealing with the diabetes prevention program. I just wanted to mention that if I could. And I just wanted to applaud you, man. Just if nothing else, I wanted to be the one to applaud you and thank you for your leadership, as well as for your dedication and your compassion. No better way to kick off the national, health for minorities, the National Minority Health Month, than to kick it off with you. I greatly appreciate your participation, Dr. Francis.
I'm really fortunate to be working for an organization that sees things this way, that makes health equity a priority for them. I'm grateful for the chance to meet with you and share this message with the community. If I may be so bold as to ask our community to think through this, be thought partners with us. We can't do this ourselves. We need help. We need partners. We need people to walk with us on this journey. And that means also in the hospital room. If you're in the hospital and your family member's in the hospital, walk with us on this journey. Stand next to us. Be partners with us as we work to treat your loved one, take care of your loved one, because we are in the same community together. Let's really work on this so we can do it. We're going to be doing it together. We can't do it separately.
Amen to that, brother. Amen to that. So listen, I want to thank you again so very much. And I want to let Trinity Health know that it's been a wonderful maiden voyage to have you on the program, being our first guest from Trinity Health program or Trinity Health Center. So I want to thank you. Hey, folks, I want you to stick around. We got more to come right here on the television program, Black Perspective.